name is Katie Couric, and welcome to Weekend Update. We are going to the streets to talk about healthcare. SB 840 passed 6 months ago. Let's find out what's happening in California since universal healthcare passed.
And now an interview with Mrs. Johnson from Atlanta, Georgia.
Hello, Mrs. Schmoop. My name is Mrs. Johnson, and I'm a mother of 4. Before the universal health care policy, I couldn't afford my meds for my diabetes at places like Old Business Hospital, Money Grubbin Hospital. I would need insulin about twice a day, and due to my pre-existing condition, I was denied by the insurance companies of that care. But now, glory hallelujah, I have access to all the meds to keep me going. My part-time job at Mervyn's just couldn't provide the health care I needed due to lack of hours. But they wouldn't schedule me no more than 38 hours a week. So what was I supposed to do? What was I supposed to do? But now it doesn't matter, because the state's got me covered under that single-payer plan of theirs. Thank goodness.
In the Stone Age of healthcare being something we had to learn from our employer, where so many millions suffered from corporate greed, and the American population alone, comprising of 300 million people, 20% of us were either uninsured or underinsured. What an injustice to our people to not offer something that is a human right, a right to life. Back in the system, 70% of the Medicaid recipients were women. Why is it women were the main benefactors of this healthcare? Because of the fact that women are disproportionately segregated into part-time and lower-paying jobs with less likelihood to receive health insurance as a benefit for their part-time work. Are we not seeing a repeat of the 1920s when women were barely being recognized as a voting member of the government, and now the system has it set up where women aren't worthy of the corporate care?
Thank you, Katie. And now we have a story on the current debate of what and who is covered under universal health care. This story specifically deals with the issue of lesbian women trying to get pregnant using new technologies.
We decided to start trying about a year ago. We used old traditional methods like a turkey baster, but haven't had much luck. So we went to the fertility clinic to see how and what was covered, only to find out it's a lot more complicated process to go about getting pregnant if you're a gay couple than it is if you're heterosexual.
Yes, exactly. Even within this new system of universal healthcare, we are still struggling with the same system of discrimination because all the models for pregnancy are based on compulsory heterosexuality, meaning legislation hasn't yet dealt with the issue of lesbians, who are biologically not infertile but who cannot get pregnant without technical assistance. Thus,
we are left in limbo, working to get our case covered so that we can enjoy the same benefits as all the other couples who enjoy coverage and help getting pregnant.
Universal healthcare is great, but it gets tricky in situations dealing with new technologies based on helping people achieve something outside the normal sick or ill. Still, it is the same problem we had with private insurances. Most of them didn't cover IVF or IUI for queer women, and some states actually legislate against it.
Yes, we definitely like universal health care. It's helped us out a lot, but in certain situations, we are still dealing with discrimination, particularly when you look through a race, class, gender, and sexuality lens.
Thank you, Anderson. Now we go to the Watts Free Clinic to see how healthcare is being distributed there.
Today we're doing an in-depth investigation into what health services look like after the passing of SB 810, which established universal health care. I'm standing outside a doctor's office in Watts, a predominantly black community in South Los Angeles. Let's go inside and take a look.
Nurse! Nurse! When will the doctor see me? Please, I'm in so much pain.
Quiet, sit down, wait your turn. Get moving. Hi, sir. Why are you in the clinic today?
I've been here for 8 hours, waiting for someone to look at my ear infection.
Oh, well, did you have insurance before this?
No, I didn't have insurance. And I'll tell you what, it doesn't feel much different now. Seems like we have the whole goddamn community of Watts here today. Now what we need is more doctors.
Well, folks, it seems that despite the progressive aims of our universal healthcare plan, real help has yet to materialize. Racism still persists in the doctor's office. We now stand in Baldwin Hills, another predominantly black community, seeking to further document the racial disparity in medicine. Let's go inside. Huh, this looks different. No security guard, friendly welcome, sparsely populated waiting room. Oh, hello sir, why are you here today?
Oh, well, I guess if you must know, I'm here to talk to my doctor about my receding hairline.
Really? Just baldness? Well, I just interviewed a man in Watts who had an ear infection and was waiting for aid.
Next patient, please.
Oh, gots to go. Bye-bye.
You know, I think I'm starting to get the picture. The clinic in Watts was certainly in a much poorer neighborhood than this one in Baldwin Hills. It seems though this divide in access to health services is based on differences in wealth rather than race. And I'm gonna go now.
Making companies have no business being involved in taking care of sick people. And I noticed that, there are people in your country that believe that that's the way to go, and to privatize more of this. And you never want a doctor or hospital having to make a decision as to whether or not they should provide help to someone based on how it affects the bottom line. You don't want to go that way. And I would be very worried about people who are trying to take you in that direction.
I argue that equity is the central challenge for the future of medicine and health. By eliminating the economic bias of who has access to medical care, single-payer health care goes a long way toward providing for the human right of health. It may also help with other areas of inequality in medicine, such as race and gender, that are often intertwined with economics and class. Current debate of what? Damn it.
Hello, and welcome to Weekend Update.
You didn't say your name.
I was about to.
Oh, sorry.
We decided to start trying about a year ago. We used old traditional methods like a turkey baster. We decided to start trying about a year ago. We used old...
I'm a cop.
Medical system before was a big business. It was only run by the drug corporations and